Hey there, welcome back to your answering channel. Today's video is all about warning signs to look out for with your baby. As a new parent, it can be overwhelming trying to figure out what's normal and what's not. That's why we have put together this list of warning signs that you should keep an eye out for with your little one. Number 1, breathing difficulties. If your baby is having trouble breathing or seems to be breathing more rapidly than usual, it could be a sign of a respiratory issue or other problem. Like retractions, grunting, and apnea. Retraction in babies refers to a medical condition where the chest wall appears to sink in during breathing. This can be a sign of respiratory distress, and may indicate that the baby is having difficulty breathing. Retraction may be visible in the area below the rib cage, between the ribs, or in the area above the collarbone. Grunting in babies refers to a noise that they make while breathing out. It is a sound similar to ha or unha that they make while exhaling. Grunting in babies is often a sign that they are having difficulty breathing or are experiencing some kind of respiratory distress. It can also be a sign of an underlying medical condition, such as pneumonia or bronchiolitis. Apnea refers to a medical condition where they stop breathing for a period of time, typically lasting longer than 20 seconds. It can occur in premature babies or in full-term babies, and may be a sign of an underlying medical condition, such as infection or brain injury. Apnea in babies can be detected through monitoring of their breathing patterns and heart rate. If apnea is detected, medical attention is necessary to prevent any complications or long-term health effects. Treatment may include medications, oxygen therapy, or the use of a breathing machine. Number 2, feeding difficulties. If your baby is having trouble feeding or is crying during feedings, this could be due to a variety of factors. First thing to do is trying their food if it is acceptable for babies about the taste. Then you could check the inside mouth if it's something wrong with it. It could be a temporary issue, like a tongue tie, a cold or teething. It is normal when they doesn't want to eat. You can check their gum. But it could also be a sign of a more serious problem, like acid reflux or a food allergy. Change with frequent liquid food like milk and give multivitamins the best solutions for 1 to 2 days. Don't panic and watch their attitude if they hold something frequent like stomach or something. It's important to seek medical attention if you notice any changes in your baby's behavior. Number 3, lethargy. If your baby seems more lethargic than usual or isn't moving around as much as they normally would, it could be a sign that something is wrong. Lethargy in babies refers to a state of extreme tiredness, weakness, and lack of energy. It is a condition where the baby appears overly sleepy, drowsy, and unresponsive to stimuli. Lethargy in babies can be caused by a variety of factors, including illness, dehydration, malnutrition, or a lack of oxygen. It can also be a sign of an underlying medical condition, such as infection, meningitis, or a brain injury. Number 4, skin changes. If you notice any changes in your baby's skin, such as a rash or discoloration, it could be a sign of an allergic reaction or other issue. Like cyanosis and jaundice. Cyanosis in babies refers to a medical condition where the skin, lips, and nails appear to have a bluish tint. This can occur when there is not enough oxygen in the blood, and it can be a sign of a serious respiratory or cardiovascular problem. If you notice that your baby has a bluish tint to their skin, lips, or nails, it is important to seek medical attention immediately. Jaundice in babies, also known as icterus, refers to a condition where the skin and eyes appear yellowish in color. This is caused by a buildup of bilirubin in the blood, which can occur when the liver is not functioning properly. Jaundice is common in newborns and usually resolves on its own within a few weeks. However, if it lasts longer or is severe, medical attention may be necessary to prevent any complications. Number 5. Fever. If your baby has a fever, it could be a sign of an infection or other issue. It's important to monitor your baby's temperature. Fever in babies can be caused by a variety of factors, including infections, teething, vaccinations, or exposure to extreme heat. The most common cause of fever in babies is viral or bacterial infections, such as colds, flu, or ear infections. In rare cases, fever can also be a sign of a serious bacterial infection, such as meningitis or sepsis. Other possible causes of fever in babies include reactions to vaccinations, teething, or exposure to extreme heat. Treatment for fever in babies may include medication, fluids, or other interventions, depending on the underlying cause. Number 6. Unusual crying. If your baby is crying more than usual or seems to be crying for no apparent reason, it could be a sign of an underlying issue. This could be due to a variety of factors, including teething or an ear infection. We all know that babies cry a lot, but if your baby is crying for hours on end, it could be a sign that something is wrong. It could be something as simple as a dirty diaper or hunger, but it could also be a sign of a more serious issue, like colic or an ear infection. It's important to speak with your pediatrician if you notice any changes in your baby's crying patterns. Conclusion. So those are the 6 warning signs to look out for with your baby. Remember, it's always better to be safe than sorry when it comes to your baby's health. If you notice any of these warning signs, don't hesitate to speak with your pediatrician. Thanks for watching, and don't forget to hit the like button and subscribe for more videos like this. See you in the next one.